Hi, everyone. I want to start by apologizing for interrupting that wonderful conversation and discussion with Dr. Swaminathan. Like I myself was learning a lot, and I'm sorry to interrupt. Uh, but thank you also, Suchitra, for intervening and allowing me some time to present on my topic. I want to thank the Medico's Friend Circle for inviting me to discuss about the intersection of climate change and cancer, two topics that I'm really passionate about. As Suchitra mentioned, I'm a gastrointestinal oncologist at Dana-Farber Cancer Institute, Boston, and really interested in the influence of climate change on cancer. It's interesting that the Medico's Friend Circle is an organization that was started by a group of intellectuals in like 80s, and now you're celebrating the 50th anniversary and continuing these important discussions. And it's truly a privilege to be here. And especially to share a platform with like eminent physician scientists like Dr. Soumya Swaminathan, who, physician scientists like myself look up to. An interesting coincidence is that I am actually reading a book. It's called India After Gandhi by Dr. Ramchandra Guha. And I'm at a section where he's talking about Dr. M.S. Swaminathan and the agricultural revolution. So it's really it's really a privilege that to be aware of this coincidence, and I'm presenting with Dr. Swaminathan. So once again, thank you for inviting me, and I'll move forward to my talk. I think someone is talking, so I'm going to try and see if I can mute that person. Okay. All right. So these are the key messages I hope to convey today. So climate change contributes to the risk of developing cancer and also impacts the outcomes. Cancer treatment itself contributes to climate change risks, and hence the relationship is bidirectional. And I hope to convey that today. And there are ongoing efforts to mitigate the carbon footprint of cancer treatments, and promoting sustainable practices would be mutually beneficial. So here's the outline for my talk. I hope to discuss about the cancer epidemiology, where we are right now, to kind of paint a picture of the current landscape. I'll talk about the cancer risk as it pertains to climate change implications. I'll talk about the climate change impact on cancer outcomes. I'll touch briefly about how cancer treatment itself contributes to climate change, and then can discuss about some mitigation opportunities as well. Dr. Swaminathan outlined in her talk very nicely about the climate change health interactions, and the different ways that climate change and the complications impacts human health. And some of these climate health interactions are more immediate and well documented. And the reason I mention it is because when we talk about climate change, cancer is not the first thing that comes to our mind. Right? There are myriad of other effects climate change has on human health. The heat wave related mortality, for instance, has increased by 80% in the last 20 years. Extreme weather events such as wildlife exposures have increased in about 60% of the countries. As Dr. Swaminathan also mentioned, food and water insecurity now affects a lot of countries, and 30% more global areas were impacted by drought in the last 50 years. And of course, the transmission rates and the duration of several vector-borne illnesses like dengue, malaria, COVID-19, even the origin and transmission of COVID-19 was influenced by the complications related to climate change. However, the impact of climate change on cancer is not well elucidated, and there are a few reasons for that. I purposely put the picture of the polar bear on the left side because the influence of human activity and the effect of climate change on other species, such as polar bear, is also not well studied, and we are still learning about the different ways where the species, such as polar bear, who is located on the pole, like so many thousands of miles away from us, are impacted by activities happening in other parts of the world. Similarly, the effect on cancer is also not well studied due to the different factors I have listed here. The first one is the time lag of impact. So unlike some of the effects that are immediate, the effect of risk factors on cancer takes time to manifest. It may take 10, sometimes even a few hundred years to manifest. And so we are not able to identify that impact right away. There is geographical variation. So for instance, the patterns of cancer incidence that is happening in one part of the world as a result of climate change may be different from that is happening in other parts. So there is that geographic variability. There are the confounding factors, the factors that a person as individuals or populations are exposed to, say in terms of environmental toxins, are different in different parts of the world or different parts of regions within a country, even though they are experiencing climate change effects to the same extent. And then there are limited number of sustained studies on the climate change impacts on cancer. But when you look at the epidemiology of cancer itself, what we see is that the number of cases from cancer are certainly increasing from 13 million new cases in 2008 to 17 million cases in 2017. When you look at the cancer epidemiology in terms of the deaths, again, we see that the number of deaths as a result of cancer is also on the rise. And cancer is on the route to become the leading cause of deaths in most of the countries by the 21st century. And the other notable fact is the disparity that continues to widen between the countries which are in the higher socio-demographic index group and lower socio-demographic index group, part of which is a result of climate change related effects, which are also distributed in an uneven fashion. When you look at the disease-adjusted life in years, cancer is a chronic illness. And so there is disability-adjusted life in years that is impacted, and cancer is the second leading cause for the contribution to the disability-adjusted life in years. Not so much so in the countries where the infectious diseases are leading cause, but more so in other parts of the world, but it's definitely catching up. And when you look at some of the common cancers, the common cancer is lung cancer, followed by some of the GI cancers, which is the type of cancer that I treat. There have been some fluctuations in terms of the contribution, in terms of the number, and in terms of the cases as well as deaths. But lung cancer is the most common reason, followed by the GI cancers. Another interesting aspect in terms of the epidemiology of the cancer itself is that we are seeing more and more younger people developing cancers, especially so in GI cancers. And these are statistics from the United States. And this is another research that I'm involved in, is where we are looking at the causes for these early onset cancers. My focus is on GI cancer. So on the left side is the number of cases from colorectal cancer, and you can see that it's decreasing when you look at all the ages. But when you specifically look at ages less than 50, you see that the numbers and these lines represent different stages of colorectal cancer. For younger people, they are increasing. And again, I want to mention something that Dr. Swaminathan mentioned during the discussion. This is not to create a climate anxiety, but more so to understand the reason so we can appropriately intervene. This phenomenon of early onset colorectal cancer is happening across the world, as indicated by the darker shades of blue. And when you look at the causes for that, there are multiple factors being mentioned, which could be exposures related to the variations in behavioral factors, changes happening to the dietary patterns, and changes in the infection transmissions, increasing risk of obesity, and other reasons. But then the question is, how much is climate change contributing to that? And so what I try to outline here is that, the cancer as a non-communicable disease is certainly increasing in terms of the cases and deaths. We are seeing more number of people being impacted by early onset cancers, especially so in GI cancers. But then the question is, how is climate change contributing to that? And when you look at the mechanisms that climate change impacts cancer, most of these studies has come up in the last 10 to 15 years. And some of the factors I have outlined here. So like starting with, say, pollution. We refer to the exposure to fossil fuel or the particulate matter. And occupational exposure. So these are factors that are proximal causes of climate change, and there are also effects as a result of climate change, such as ozone depletion and the ultraviolet radiation exposure that has led to the increasing incidence of skin cancer. There are effects as a result of nutritional alterations and increasing obesity that drives certain forms of cancer. And then heat and temperature effects. So it is been observed that as a result of the changes in global temperature, there has been changes in the distribution and prevalence of several pathogens, such as the fungi with released aflatoxins that cause liver cancer, and that has led to changes in prevalences of certain cancers, such as liver cancers, and also the cancer-associated pathogens. So schistosomias is a pathogen or parasite that has been shown to be associated with bladder cancer, and changes in weather-related events such as flooding causes changes in the prevalence of this parasite, and that in turn causes changes in the prevalence of bladder cancer. But an important factor to also realize is that these effects are variable. So it doesn't necessarily mean that these climate change related effects always causes increase in cancer in a particular area. So there are certain cancers that may increase and certain other cancers that decrease. And so it's hard to predict without longitudinal studies and a robust like a research into capturing these effects. And however, that is necessary so we can perform some of the actions such as the climate adaptation and mitigation efforts that are required to appropriately manage them. And to speak about some of these aspects of this mechanism. So air pollution, and you can see that a lot of the references that I'm citing here came from WHO and the other groups and initiatives that has been led by Dr. Swaminathan and team. So really want to appreciate all the research work that is being conducted by their team. But I want to mention that, so the Lancet Commission now recognizes air pollution as a leading cause as a carcinogen, as a causative agent for cancer, as it contributes to 40% of lung cancer deaths. And you can see on the right side that the lung cancers that are attributed to air pollution has been steadily increasing. In terms of the carcinogens itself, these include several gases such as nitrogen dioxide, sulfur dioxide, ozone, particulate matter like PM10 and PM2.5 are now considered as indicators of air pollution as a result of their contribution to pulmonary or lung diseases and also cancer. These polyaromatic hydrocarbons, which are considered as a carcinogen, can attach itself to these particulate matter and can be inhaled and reach deep inside our lungs to cause some of these cancers. And we have noticed that there has been a 20% increase in particulate matter related lung cancer in the last 3 decades. When you look at ultraviolet radiation exposure, this is something which a lot of us may be familiar with. UV radiation has a direct link to melanoma, a form of skin cancer, and is attributed to be causative factor for 76% of new melanoma. And as a result of this ozone layer depletion, there's been an increase in the exposure to ultraviolet radiation and causing melanoma. We have noticed a 33% increase in melanoma cases in the last 3 decades. And another aspect is also that in some countries, like even like United States and Canada, parts which used to experience, say, just a few months of summer, now experience more days of exposure to sun. And so there is a change in behavioral aspects of people, that there is more exposure to sun, which also in turn is a risk factor for some of these skin cancers. So it's not just the ultraviolet exposure, but it's also behavioral changes as a result of some of the climate changes. And also the nutritional changes. It has been well documented that climate change leads to changes in our food patterns and leads to decreased access to healthy diets, such as whole grain, fruits, and vegetables, while also causing increased access to unhealthy foods, leading to comorbidities and conditions such as obesity that is also associated with several cancers. And you can see that when you look at the trends in diet-associated cancers or cancers for which diet is a contributing factor, we are seeing increasing number of those cases as well. But the impact of climate change on cancer is not limited to causing increased number of cases of cancer only. It is also related to outcomes from cancer. And just for those who are not familiar with the care of a cancer patient, I just want to mention how complicated or complex it is. So a treatment of a cancer patient is very multidisciplinary. It does not only involve a medical oncologist or a physician such as myself. It involves surgeons, it involves radiation doctors, it involves pharmacists, nurses, social workers, dietitians, care coordinators, a lot of people. It's very resource intensive. So people who seek care for cancer, oftentimes they have to come every day to the cancer center for weeks to complete their treatment. And even if they complete the treatment, they have to come afterwards to continue the monitoring for cancer recurrence. So it's very longitudinal, and ultimately the cancer treatment is toxic. It kills some of the normal cells in our body, making a person vulnerable to, say, infections and other conditions. And so the reason I highlight is that these effects make cancer care very complex. And so the effect of climate change related complications on cancer patients is very dramatic. And those are some of the mechanisms that I have outlined here. So for instance, the extreme temperatures or heat waves, these people who are, already vulnerable to dehydration, dehydrated from, say, diarrhea, vomiting from chemotherapy, are more susceptible to climate change effect and heat effects as a result of the climate change. It has been shown that every 2 degrees Celsius increase in temperature can lead to increase in surgical site infections by 2%. So cancer patients require surgeries. And so a complication of surgery is infection, and the risk for the infection is increased as a result of climate change related extreme temperatures or heat waves. The extreme weather events or hurricanes can cause supply chain disruptions. I just showed you how complex or interdisciplinary cancer care is. And so the supply chain disruptions and destructions of the healthcare records can have dramatic effects on outcomes. And when I'm talking about outcomes, I'm referring to increased hospitalizations or deaths. Infections. It's been shown that during exposure to hurricanes that happen in the United States in the recent years, vulnerable patients, such as cancer patients, had a 2-fold increase in the risk of being colonized by invasive mold that can then lead to more hospitalizations and increased hospital-related deaths. So the individuals who are suffering from cancer are vulnerable to these complications also. And then ultimately, as I mentioned, poor nutrition or malnutrition effects are also exacerbated by the decrease in access to healthy food as a result of climate change related effects. One important aspect worth considering or knowing about is the harvesting effect also. So what is meant by harvesting effect is that the climate change related harmful effects oftentimes affects people who have a limited life expectancy, unfortunately. And so when we look at the climate change related deaths over a longer period of time, we may not see the effect because these effects are seen shortly after the climate change related effects, such as, say, hurricanes or flooding, etc. So there is more fluctuations. And oftentimes when we just look at, say, effect of climate change, or even like over 1 year or 2 year or 3 year, we oftentimes miss that effect that happens over a shorter period of time. And ultimately, the lack of preparedness or climate action plan contributes to these adverse outcomes as well. just to give a couple of examples. So when Hurricane Katrina affected United States, there was a 15% increase in mortality among cancer patients affected by breast and lung cancer. Superstorm Sandy caused hospital closure for about 4 months, impacting time to treatment. On the right-hand side is a picture just outside of MD Anderson Cancer Center, which is the #1 cancer center in the world. But as after the hurricane, the hospital had to be closed down because people could not reach the hospital as a result of floods. So you can have such direct effects on people who are seeking treatment for cancer, impacting their not just the cancer treatment and cancer recurrence, but also leading to complications such as deaths. One important factor that is also need to be mentioned is the healthcare disparities that are confounded because of the climate change effect. So before moving to Boston, I was in Cleveland, and on the top right-hand side is actually a Google satellite image of the city. You can see that there is a strip here which is less green color compared to other parts, and these are the areas which is a higher density of Black population. So this is true for other parts of the United States and several other cities as well. So the effect of climate change on even cancer and the complications I mentioned are borne by people such as who are subjected to historic disparities. This may be Black, Hispanic, indigenous populations in the United States, or people who are subjected to caste-based discrimination and other sorts of discrimination in India, for instance. Oftentimes they are located in the outskirts of villages. And so they live in proximity to polluting industries, and the effect of climate change related complications are borne oftentimes more so by people, and addressing climate change related impact on cancer population should also take into consideration some of these systematic discrimination that has happened over hundreds of years. So I cannot stop without mentioning the cancer treatment contribution to climate change itself. So I mentioned how cancer treatment is complex, but as a result, the treatment itself contributes to climate change. And this could be the carbon footprint of transportation, the carbon footprint of facilities and treatments, like in terms of when you're operating, say, like radiation treatments throughout the day, when people are staying in the hospital requiring long chemotherapies, there is carbon footprint associated with it. The manufacturing is impacted, and they contribute also to the carbon footprint that in turn leads to some of the climate change effects. Professional meetings. I myself, as a physician who is also a scientist, we have to travel for meetings and to collaborate. And it is one of the studies that recently came out showed that 35% of a scientist's total carbon emissions come from these travels. And this is not to make people feel guilty, but just to be aware so that you can modify your behavior and lifestyle to, try to follow a carbon neutral lifestyle as much as possible. So I hope I try to show how climate change impact on cancer happens across the spectrum, right from the exposure and the proximate causes that lead to cancer to complications and ultimately bad outcomes related to cancer and impacting these survivorships. But then we also need to think about mitigation opportunities. And so I was in Cleveland Clinic prior to moving to Dana-Farber in Boston. So we looked at one aspect of the contribution of healthcare system, which is the healthcare employees' contribution to climate change or carbon footprint through their travel. And we found that Cleveland Clinic and the two other institutions, their employee travel itself contributes to about 70 million kilograms of CO2 emissions in a year. And when you look at on a per individual basis, it comes down to 1,800 to 3,300 kilograms of CO2 greenhouse gas emissions per individual, which is about 5,000 to 8,000 miles driven in a car, and that is equivalent to the carbon that is sequestered by 2 to 4 acres of forest. So you need 2 to 4 acres of US forest to sequester the amount of carbon that is emitted by individuals who are traveling to the institutions. And so to intervene on that, we need structural behavioral changes. For instance, for commute-related carbon footprint, institutions such as the ones that I have been part of have engaged in several structural interventions. These include establishing electric vehicle charging stations and some other, easier interventions such as commuter advantage program for people who are using public transport, arranging shuttles to public transit stations, discounted parking rates for carpooling. Anyone who have traveled to the United States would have seen these high occupancy vehicle lanes in cities such as Boston. So in the morning commute time during rush hour, you have a lane that is reserved for people who are traveling as a group. So more than one person in a car gets to use that lane. So there are certain incentives for carpooling. And then, of course, technology enabled remote working and telehealth as much as feasible, and then educating employees about institutional sustainability goals. Ultimately, though, mitigation efforts will require a lot of other interventions. So education, decarbonizing efforts, some of which I mentioned, research to understand the reasons for the greenhouse gas emissions, addressing disparities, and of course, building resilience. I have been proud to be part of 2 institutions, Cleveland Clinic, and then subsequently Dana-Farber and Harvard, which takes sustainability as a priority, where there is active research and a team that is involved in investing in efforts to decrease the carbon footprint of the healthcare system itself. And I think such efforts need to be done by the healthcare systems also to show solidarity in the measures to mitigate climate change. And fortunately, our organization of the oncologists, the American Society of Clinical Oncologists, just last year adopted these policy statement to recognize climate change as an important factor impacting cancer incidence and outcomes for our patients, and to influence policies and force the government to take measures to mitigate climate change. So to conclude, I hope I conveyed how climate change can contribute to risk of developing cancer. And although we are learning more and more about it, cancer treatment itself contributes to climate change-related risks, and ongoing efforts to mitigate carbon footprint of cancer treatments and promoting sustainable practices would be beneficial, not just for the cancer patients, but as a community as a whole. And I was part of this group that recently performed a scoping review of the climate change effect on cancer risk, and a lot of references that I used are from the scoping review, which is part of an invited review for Journal of Climate Change and Health, which we hope to publish soon. These are some of my key references I have used, but I cannot start without mentioning a book that I found deeply inspirational for my work. It is Ishmael by Daniel Quinn. So when we talk about climate change and health impact, and also climate change and cancer that I talked about, we follow a very human-centric view, right? But when you think about the causes of climate change, it is because we human beings ignore the fact that there are all other species that exist on Earth, and Earth itself exists. If you ignore all that, the climate change is will continue to happen, and there won't be any solution to this. And so in this book, it's very interesting. The gorilla is actually portrayed as a teacher, sort of teaching in a Socratic way to the pupil, his pupil, about how we can, stop being so human-centric and selfish from a human standpoint, and have a more of a universal view. It's not a religious book. I'm not religious or anything. So I do totally endorse it. I encourage anyone who's interested to try to check it out. So that's all I have. I once again want to thank the organizers for giving me this opportunity. And once again, it's a privilege to share a platform with a key leader in the field, such as Dr. Somnath, and I'm happy to take any questions. Thank you.
Yeah, thank you, Thejus, for your excellent presentation. And these days, people are aware of much more about the lifestyle modification and the link between lifestyle and cancer, related to whether it is diet or physical activity or things like that. But then, rarely do we think about climate change and health. So thank you for bringing out all those things. And now the floor is open for questions. And there are a few questions in the chat box. Hope you can follow it. Tejas?
Hi, Sujitra. Yes, I can. I can see the chat as well.
Okay. Okay. So should I read or you will go through and answer
I can go through it.
Oh, that's fine. That's fine.
Yes, definitely. I guess the question I can see is about the epidemiological certainty with respect to some of the causes attributed to climate change and cancer. Yeah. So, so for some of the the element of vagueness. Yeah. So I think there has been this sort of skepticism for a long time about how much climate change contributes to cancer. And there's certainly been that lack of awareness. And part of it is as I pointed out in the beginning part of my section, the time it takes for the climate change to cause cancer, the geographic variability that happens, and the lack of any studies. But now we are definitely there are several institutions that are investing in research, and there are certainly a lot of data to support several climate change effects, some of which that I pointed out, that links climate change related effects to cancer directly. And so the relationship is certainly strong. And so I think it is time to recognize that impact and take robust measures to not just to mitigate climate change, but also to take measures to build climate resilience for people who suffer from cancer. Thank you for the question. Hi, Dr. Jayakrishnan, please go ahead.
Yes, Dr. Thejus, thank you for that excellent talk. Enjoyed it very much and learned a lot. There's a documentation that nearly 200 to 250 species are getting extinct on a daily basis because of climate change. Is there any study to suggest that intestinal microbes or commensals are also getting extinct in the human body, which is leading to increased cancer incidence? Is there any studies like that? Would you think that that would happen?
Dr. Jayakrishnan, that's a very interesting question and something that I'm really involved in because, as an oncologist, my research, my translational research actually looks at the fluctuations in microbiome and how that may lead to some of the cancers, such as the early onset cancers that I mentioned early on. We certainly are noticing differences in the microbiome of cancer patients compared to normal patients. We also see differences in the microbiome of people who develop cancer earlier in life compared to later stages in life. And the studies that we have conducted, our own group, mostly epidemiological, but also some mechanistic studies, mostly point out the changes related to our dietary patterns. And we notice, even countries like India, as we move towards more of a Western diet meaning, more meat-containing food, use of more sugar-enriched food, high fructose corn syrup, and things like that, and preservatives. We certainly have in the microbiome changes, and that does correlate with increasing incidence of cancer. So we definitely notice that. I do believe that the pollutants that we ingest as a result of climate change is also probably contributing to that. But ultimately, the factors are multiple, and it's hard to tease out what is contributing to what extent. But certainly there has been intestinal microbiome changes. I do think that is partly the reason for some of the cancer-related epidemiological changes that we are seeing, certainly for GI cancers. But the solution for that would I think someone asked about shifting to whole food plant-based diet, foregoing poultry. I don't think I can completely agree with that. I think the goal should be to have a balanced food. That does include certainly like fresh fruits, vegetables, whole grain, but meat is also okay. But what we aim for is to have more of a balanced diet. I don't think, at least there is no data at this time that a whole plant-based diet is superior to having a like a balanced diet. The data is more so from changes in our diet patterns, like what I mentioned earlier, that may be contributing to cancer. And certainly the climate change may be contributing, especially through the pollutants that we may be exposed to. But that's certainly, and like our research team is trying to identify these microbiome changes to see if we can manipulate the microbiome to alter the causes for alter the mechanisms how it leads to cancer, and also develop biomarkers that can help us screen for cancer early, so we can detect early. But thank you so much for that question, Dr. Jugita. It kind of like brings my two interests together. Hopefully, we'll have more answers soon.
Thank you. Hoping to hear from you on that later in future as well. Thank you so much.
Of course. Thank you, Dr. Jugita. Yeah, I think the next question. Thank you, Dr. Bhargava and Dr. Shah, for the mention. I think Dr. Janardhanan talked about economic impact of cancer due to changing nature in resource-poor countries like India, and to give equitable access. I think the aiming for equitable access and addressing disparities caused by climate change should not be thought independent of the other measures that are being taken to address these disparities. But we do need to be mindful of climate-related injustice that have led to differential impact, as I pointed out, say, Black and Hispanic populations in the United States, some of the marginalized communities in India who are suffering from the consequences more so from their other populations. So we need to be mindful of that. But I think addressing that is mainly addressing the root causes of the historic discrimination that is existing in different societies. I think that would be the goal. And in terms of how the policies that needs to be changed and the economic impact of cancer, that's not mainly my area of expertise, but I am certainly aware of the economic impact of this cancer. You can imagine that, the complications related to climate change effect on cancer, more people getting hospitalized, more people developing cancer, certainly has cancer climate change impact. So, the economic impact. So yeah, we cannot understand the economic impact of climate change effects on cancer. I think I answered the question about the increasing cancer cases under 50 age group. Is there any data suggesting regions more severely affected by climate change observe differences in cancer prevalences and progression? Thank you, Abhinav, who is also a budding oncologist. So thank you for this question. Yeah, so data do point out that there are like geographic variations, but it's more so with, say, effects such as flooding or hurricanes that causes like delays in cancer care that then leads to more complications. And then, you can imagine how that lead to, like, say, things such as infections that lead to infections in cancer patients who are already immunosuppressed. But otherwise, I think the climate change related effects are more kind of global, and places that experience climate change effects more certainly affects, gets impacted by cancers that are impacted by that sort of climate change. So for instance, flooding and, like, say, schistosomiasis and bladder cancer, or the extreme weather, like extreme heat and transmission factors for like fungal alpha toxins and liver cancer. So that may be impacted by areas that are more prone to those weather events. On the other hand, places like in the United States where there are more people with, less melanin in their skin, and people who have more like to go out for like sun-related exposures, they may face consequences of ultraviolet exposure and melanoma more. And I think, like, if you remember the graphs of that UV radiation exposure and melanoma, the burden is borne more by like Western countries than in other parts of the world. So certainly there are geographic disparities based on the climate exposure to climate change related exposures. the impact due to marine plastic pollution and role of microplastics. Again, it's mostly the effect of pollution and plastics on the health in general. There is more data that the microplastics, and that's not just the pollution, but even some of the plastics that we may be exposed to from given the water bottles could be, impacting the microbiome or can have effects on our health. But again, the data is not sufficient enough that we can say that we should stop drinking from plastic bottles or stop using plastics altogether. But I think the focus should be more on recycling plastic, minimizing the use of plastics, because these are all non-renewable and difficult to these are elements that contribute to climate change. So I think the focus should be more on reducing the use to minimize the plastic and impact climate change that way. But yeah, I do think that if you have more exposure to pollution in plastics, that may down the lane contribute to health and cancer. Yeah. I think there is another question, Desham.
Hey, hi. So actually, I'm from public health background, okay? So we usually do hear a lot of things like because the screening capacity of the diagnostics have increased, and hence we are seeing a lot of cancer cases. So how far is that true, and how far is it adjusted? That's my question number one. And second question is we have a lot of industrial pollution, and apparently I don't think that you have shown the graph related anything to industrial pollution, if I'm right. Are we placing too much of burden on people without placing the actual responsibility on the industries which are responsible for so much of emissions and all? So these are the two questions. Thank you.
Certainly. So yeah, two great questions. Thank you for asking that. Yeah, in terms of the the first question about how much our diagnostic methods have improved, maybe leading to increasing cancer diagnosis. I think to a certain extent, of course, that is contributing to we have more advanced, say, imaging techniques. Gastroenterologists are able to do more sophisticated endoscopies. So you're able to detect more cancers. So I think that is definitely contributing. But multiple studies and modeling have shown that the increase in cancer incidence that we are seeing is disproportionate to what we would expect from merely the technological advancements in detecting those. So I hope that is clear. And so, in terms of the early onset cancer that I'm seeing, right? So when we're seeing more number of younger people with cancer, we're not just detecting earlier stage cancers. Sometimes when we see people with cancer, we are actually seeing more advanced stages of cancer. And we also see the disease that differ in terms of the biology, and how in terms of how it responds to, say, chemotherapy or some of the conventional treatments. So I do think that the improvement in diagnostic technology is contributing to some extent, but that does not completely explain the increasing incidence of cancer that we are seeing. To answer your question about if we are placing enough responsibility on, I think that's something which everyone who's advocating for climate mitigation, I think it tries to address, is for everyone to take up responsibility, and that certainly includes, industries that are, emitting pollutants. I think I did show the contribution of the air pollution, a majority of which comes from the industries, but also from vehicle-related emissions. But I think, yeah, we certainly need to have more measures to, control the pollution. But then, in order to do that, I think from a healthcare standpoint, a lot of us in the healthcare sector and in, say, oncologists such as myself, what we're trying to do is also to show solidarity, and in terms of demonstrating that we are doing something ourselves. And that's why we have had several initiatives that I talked about in terms of at Cleveland Clinic. and at Dana-Farber and Harvard, what we are doing is that we have sustainability initiatives where we are trying to decrease the carbon footprint of the hospitals itself. So like for in the United States, like about 10% of the carbon emissions. So 10% is not small. So 10% of the emissions actually comes from the healthcare sector itself. It may be lower for India. I'm not sure how much it is. So we are taking measures to like mitigate that via multiple methods. So through addressing the type of procurements that we are doing, through like the using more solar power or renewable sources as opposed to non-renewable sources of energy. Some of the efforts to decrease commute by pollute vehicles. Using single occupancy vehicles and relying more on electric vehicles. So there are several things that we are trying to do, even like in terms of food and other things. So we are trying to do those kind of aspects to decrease the carbon footprint of the hospital system. So we can also, we are on a, morally in a ground that we can say that, hey, we ourselves are doing this, but we are still seeing more number of people who are bearing the burden of the climate change effects that are caused by polluting industries. Can you also share this burden? And I think climate activists are doing this, and I think we certainly need more advocacy efforts. I hope that answers your questions. But thank you so much for that.
Okay, Thejus, you just missed one question. By Siddharth Narayan, can shifting to whole food plant-based diet, foregoing poultry and red meat control, the progress of risk factors in colorectal cancer? That question, I think it was there in the chat box. Maybe that's the...
I think I did try to address it briefly, but yeah, I can certainly elaborate. So I can say that at this point, there's no data to show that shifting to a whole plant-based food will help you help prevent cancer. I think the causative factors for cancer is multifactorial. So just by changing your diet can help mitigate the effort. But certainly, what we certainly advocate for and advise our patients who try to prevent cancer to family members as well as people who are undergoing treatment is to try to follow a balanced diet. That includes access to whole grains, fruits, vegetables, and meat, that is included in your diet normally, but try to avoid, too much of say red meat consumption and colon cancer. There is a linkage that has been shown, but that is related to higher amounts of consumption that is followed in in the Western countries, not so much as in India. And effects as a result of switching to food that includes a lot of sugar sweetened beverages, high fructose corn syrup. That leads to say things like obesity, which has been shown to be a risk factor for liver cancers as well as colon cancers, and other effects such as using food that has a lot of preservatives in it. So we try to we tell our patients to kind of try to cook fresh food as much as possible and avoid using over-the-shelf pre-cooked meals, which is very common in the United States. And I must confess, it is hard for even someone like myself, living in the US, to completely do that. But we try to do fresh food, try to cook myself. I think it's more feasible in India, where you have access to fresh vegetables, than in places like United States, where you have to rely on frozen vegetables and such. So I think the goal should be to follow a balanced food, have a healthy lifestyle in terms of exercises, try to avoid relying on foods with preservatives and such, rather than maybe switching to full plant-based food. And all I can say is there's no enough data about it. We are trying to study and understand that. Thank you.
Dr. Thejus, can I ask a question?
Absolutely.
Your presentation was extremely informative and interesting. I want to ask one question. You were talking about particulate matter 10, 2.5, nitrous oxide, carbon dioxide, and carbon monoxide. All these gases are emitted when municipal solid waste is burnt, and also from the landfills and dump sites. So I just want to know whether there is any direct connection, any studies to show that there's an increase in cancer incidence related to municipal management of municipal solid waste?
Yeah, not so, and it may be, there is a lot of data out there. It may be something that I've not seen myself, but I'm not aware of a municipal solid waste. But certainly, there have been linkages in terms of areas where there is where there is no or like solid waste management is lacking, higher risk of like infections as opposed to places where there is like a better management. But some things like nitrogen dioxide, like one study as an oncologist that comes to my mind is there are studies that have shown that people have linked, like say, nitrogen dioxide in the environment to the risk and complications from leukemia, which is like one of the most aggressive forms of blood cancers, leukemia. So people have linked nitrogen dioxide to the deaths from leukemia. So there are connections that have been made in between different elements. I think solid waste management and emissions are related to the effects on cancer. Like I'm not aware of any direct data linkage. Again, in places like Louisiana, which is like the part of the state, like Louisiana and Texas, were the states that were impacted by hurricanes in the United States. So the flooding led to the overwhelming of the pollution, like the waste management situation. And so there was all this spillage. And, we do think in some of the rising number of cancer cases that we saw in the aftermath may be like related to these exposures. But again, the issue is you don't see the effect of these pollutants on cancer until like say 30, 40 years down the lane, sometimes even longer. So we definitely need more research to understand these linkages. One question from Akhil about electric vehicle field generated by batteries and electric systems causing cancer. Yeah, there is no there's no connection between exposure to electricity or electromagnetic field to cancer. I think the advantage of you switching to say electric vehicle and from a carbon following a carbon footprint reduction standpoint far outweighs any of such risks. But I think it comes down to more of an economic burden from like switching to electric vehicle and the infrastructure that is required to support that.
Just one question on these pesticide residues in food and relationship with the cancer, especially vegetables and fruits. And this is a great concern in changing over to vegetable diets and consuming fruits these days, especially in Kerala and all. And what is your opinion of that?
Yeah. I mean, that is something which needs to be monitored and investigated. Certainly. So the proximate causes of these climate change related effects are things like pesticides, right? Like, so I think there's a very well documented connections between the pesticide use, like endosulfan. I mean, we in Kerala know it by we have read about it in newspapers. I have a personal connection with that story because my dad was my father, Dr. Jayakrishnan, was like involved in the research investigating endosulfan use and the effects on the congenital malformation suffered by kids. And a personal story I would like to share is that I was a medical student in at AIMS, New Delhi, when my dad had to come to testify before Indian Council of Medical Research about their research on endosulfan and the effects on the children. And I could see the kind of calls that he was getting and the newspaper reports. They were trying to destroy any efforts. It was all it was the sort of things that you would like see in movies, like, trying to like show how the research was poorly conducted, how they questioned the ethical practices and everything, while there was very clearly established linkage between endosulfan and the congenital effects. So the reason I mentioned that is because that was something which happened right in front of our eyes, right? And it happened right in front of the eyes, and still we ignored it for like years. So when that is happening, to show something like the effect of pesticide on cancer it requires time and effort. And there are like, luckily for like, there are like more and more physicians and scientists who are like interested in researching on it. We certainly know that pesticide residues do contribute. So how people have looked at it is by like measuring like the pesticide contents in the water and the risk for cancer. People have definitely shown the linkages. There's certainly links, but in terms of, I can only imagine that how the pesticide content in the vegetables can also lead to that. But the way to prevent that would be to efforts to follow, say, more of organic approaches to like agriculture.
Oh, it's
those kind of things.
getting broken.
Oh, I'm sorry. I can repeat if it was not clear. What I was I'll try to conclude. What I was trying to say is that, what we definitely have evidence to link pesticide residues in water, in the groundwater and the water that is consumed to the cancer risk. There has been epidemiological studies that have linked. I am not aware of these studies directly linking vegetable pesticide content to the cancer risk. But the thing is, pesticide linked to things like the congenital malformations is already there. So we already know the health impacts of pesticides, and that should motivate us to follow better sustainable farming practices. So the solution is not to stop eating vegetables or not to follow a balanced diet. The solution is to follow sustainable farming practices, organic farming, promoting some of the more traditional sort of farming practices that we used to do. I think those are the efforts that we need to do. I wish Dr. Swaminathan was still here, given how her dad, Dr. Swaminathan brought about the agricultural revolution in India. I'm hoping there will be more insight we need scientists like Dr. Swaminathan and such to really put their mind into, India has come forward and really increase our food production through agricultural revolution. But how can we preserve some of the sustainable farming practices to prevent some of the effects, such as the pesticide effects on our food and effects on other ecosystems from happening? That definitely needs more research. Thank you. But I'm not an expert in it. But all I can say is we should definitely continue research to address these concerns.
Dr. Thejus, the talk was very informative. I have not a question, it's a comment to make. The slide that cancer treatment itself causes climate change and a bidirectional relationship. It is very interesting.
Yeah, definitely. Yeah.
This can be said about all other diseases. Treatment of any other disease can cause climate change and bidirectional relationship is there. Similarly, gathering of doctors, it can be the same thing about any gathering of people. So any human intervention can lead to climate change. That is what
absolutely. Yeah. Yes. Thank you, Dr. Krishna Kumar. Yeah, I focused on the cancer part of it because that was the focus of my talk. Yeah, certainly from a global standpoint, yes, the healthcare systems also contribute to climate change. I think that's a key factor that we need to recognize, is that climate change puts burden on the healthcare systems, but healthcare systems also do contribute to climate change, and therefore that's the reason why, as healthcare professionals or people who are in healthcare activists, our goal should not be just to advocate for, say, reducing pollution or recycling, but I think we should follow it on a day-to-day practice. We should advocate for, climate-friendly policies within our hospitals and healthcare systems. And it's not just infections or cancer or other diseases. It's even, you must be aware of the mental health impacts. So from cancer standpoint, people have mental health implications, but even otherwise, the psychosocial distress caused by the climate change related effects can only be imagined. So yeah, the whole healthcare spectrum is impacted by climate change, but then taking care of these people and the infrastructure also contributes to climate change. So the relationship is bidirectional, that awareness is key. I think Dr. Shiva mentioned about the herbicide Roundup and the US ordering Monsanto to pay compensation. Yes, so that's, thank you, Dr. Shiva, for mentioning that. That's the case actually that I was referring to, I'm proud of the fact that my father was involved in the investigations related to Monsanto and bringing them to pay the fine, and involved in some of the research related to the endosulfan impact on the climate effects in Kerala. So I have that personal connection with this particular situation, but I'm keenly aware of this situation, and I think we definitely need climate change advocates. We need activism in healthcare to monitor these effects. Yeah, thank you.
So I think it's almost over. Questions? Anybody? So thank you so much, Dr. Thejus. It was quite informative, And
Next, please.
pardon?
Next, please.
1 minute. Thank you all participants for enriching the session. You know, your questions enrich much more than anything else. So next week we have our session. I'll just read the title now. Changing public sector healthcare system
And deepening
and
private.
deepening private. Sorry, I'll just again say that the next session is on changing public sector healthcare system, especially in the context of deepening privatization in India. So all of us should join. Next Saturday, we all will meet. Sorry, next Thursday. Thank you again, Dr. Thejus. Bye-bye and good night.
Thank you so much, Theresia. Thank you, everyone.
Bye-bye.